to interview all the way. There will be a 1 hour segment on interview. So listen carefully, take notes, tell your friends, and hopefully your application will be very good. So um, the first thing about application process, it's pretty elaborate, as you know. Um, the number of things you need to know, it should be very clear. There should not be any question why this is so. It should be very clear. And more importantly, you should be able to explain during the interview why you wrote such and such. If you write something that you did research on A, B, or C, but you cannot explain what A, B, and C was, then they will immediately discard your application. So be very, very clear about what you write. Um, do not make mistakes on spellings. The English should be absolutely correct. I would recommend that you show your application to an English teacher. You may know somebody from high school, a seasoned English teacher who can read your application, figure out what needs to be changed. It's a very useful exercise. I've done it myself, even at this level. When I write an important document, I usually have someone who is an English teacher or something like that who can review my application and give me some points. It's very useful. It costs practically nothing. And as I don't have to tell you this, but it should be truthful. You cannot exaggerate with a flowery language what you haven't done, because they will catch you. They will ask you, what does this mean? And it should always be truthful. You should be, even the truth is not to your liking, it doesn't matter, as long as you can explain the truth. And follow the old, thousands of years old Aristotle's three things: logos, ethos, and pathos. Any writing, like a personal statement, should have those three elements. Logos means logical. It should be logical. So someone like me reads your application and sees things which do not make much sense to me, then it's not logical. So you have to consider your application from somebody else's point of view, my point of view, program director's point of view. Ethos means it should be ethical. It should be, it should touch your senses, and the word ethics is a huge term, but it should be ethical. And it should be pathos. Pathos means feelings, not pathology. Pathos means feelings. So when I read your application, it should evoke certain kind of feelings in me about you. So write a statement, repeat it, show it to an English teacher, show it to somebody who is senior, not your seniors who are 2 years older than you. I would recommend that you create a network of attending physicians, even in your own school. It doesn't matter. Your dean, for example, or your educator in your own school. Do not undervalue your home country resources. So if you're coming from India or Pakistan or Bangladesh, there are plenty of good people, well talented, very knowledgeable. You should cultivate a relationship with them and have them participate in your application process, because that will help you a lot. And I will come back to the letter of recommendation. So we talked about personal statement. If you have questions, you can post them on the website, and Jimmy Bush will finally tell me what they are. And personal statements, in my mind, every program director is different. They expect different things. From my point of view, it should be a story. Start with a story that when you were 5 years old, you saw your grandmother dying from A, B, and C, and since then you have been thinking about medicine or something like that. A personal story carries a lot of weight. Or if you saw a patient in medical school, which you still remember because of whatever happened, tell a story and start with the story and then develop it further why you are doing this. Uh, the And once again, have it reviewed. There are websites You can pay money and have it reviewed. There is a website called Harvard Square Essays. You may want to look at it. Harvard Square Essays. It's costly. They charge you about $190 to review a statement. But in my mind, it is worth the expense because you spend a lot of money anyway. So use your money wisely. And there are other sites. I'm not advocating this particular site. I have no interest in and no conflict of interest or anything like that. But it may be worthwhile investing your time, resource, money into something like that. Because you don't want a statement, personal statement, where you struggle to write, and then the program director picks up a typo. That is not good. You should be 100% correct in your English, punctuation, comma, period, all those things. And it should not be too long. Nobody has time to read, and it should not be repetitive. If you stated once something, do not repeat it until it is absolutely necessary. The letter of recommendation becomes a problem. All of you probably believe that you need a letter of recommendation. That is true. And there's another belief that it has to be from US. That is not true. It is partially true, but it is not 100% true. If you can get a good letter of recommendation from a US faculty, and that depends who is the person who writes it. If the person is an ordinary physician practicing medicine in some office alone, solo, that letter does not carry much weight. If you're going to write, get a letter of recommendation, ideally it should be a US faculty on a medical school list with a faculty appointment such as assistant professor or something of that sort. And then they write a letter, personal letter for you. It cannot be a rubber stamp because this is what we are seeing. As a program director, I interviewed thousands of people for 49 years. So I have the experience which letters carry weight. And it takes me about less than 30 seconds to put the letter in a garbage can or put it back on my desk. I'm not exaggerating. I'm telling you the truth. You need to know that. It will upset you because my goal today and next 3 seminars is to upset you. I am going to upset you by telling you the truth. And you need to digest that because it's not difficult. But letter of recommendation, you spend a lot of energy, time, flattery to get a letter of recommendation. You don't have to do anything. You are 100% capable of getting a good letter of recommendation. I don't know you, but I know that you have gone through a medical school. There is no medical school in the world which is easy. So you have already gone through that. You have proven that you are capable of doing things. The only thing you have to do is to add to what you already know. And you can't just go to somebody, let's say you go to a hospital and do a rotation for 4 weeks. By the way, this 1 week rotation is completely bogus. You do not want to do a 1 week or 2 week, ideally 4 weeks. Because how can I know you if you spend 1 week in my hospital? No way. So what I do, you press on me and then I write you a letter. The secretary really writes a letter. You don't want that. You want a personalized letter. Can be short, can be 10 lines, doesn't have to be big, but you want a personalized letter. And most important, you should never pay for the letter of recommendation. That is illegal and unethical. And I know there are doctors in this country, particularly in New York State, they charge you $900. The last time I checked with someone, they said he paid $900 to get one letter of recommendation. Once again, that is illegal. Your letter of recommendation is going to be, I showed you last time, a portfolio. You remember this? Personal, professional portfolio, where you write everything you have done in your life. Most of you are in your 20s, 25, whatever age you are. You have accomplished a lot of things. And I am not talking about medical school. I'm talking about kindergarten. I'm talking about grade school. I'm talking about high school. I'm talking about college. So if you were in a debating society in college, that should be in your portfolio. If you are an artist and you won a prize for drawing something or photography or sculpture, take a picture and put it in your portfolio. Make your portfolio like an essay, like a poetry, with a good language, good art, good colors, good fonts. You know all that technology. I don't, but you know. And you can create this gentleman created this portfolio for 1 month rotation. Look at the size of it. I wish I could show you. And he is heading now for a GI fellowship. He got residency in our program based on this portfolio because he does not have too much experience in clinical medicine. He's an international medical graduate from Slovakia and very methodical portfolio he wrote, meaningful. So when I met with him with this portfolio about a couple of years ago, I asked him a lot of questions. And they will ask you, if you submit your portfolio, what does this mean? You should be able to explain immediately what it meant. But if you fumble there, then it's going to be fake. So please be careful what you write. Put pictures. Chinese people say that a picture is worth 1,000 words. So wherever applicable, get a picture. Pictures are very easy to get now from Google. So if you see a case of abdominal pain, you may want to put a picture of abdominal pain and the diagrams. So which quadrant has pain and what it means, something like that. Be imaginative and do that. Don't be afraid. Don't be shy. Express your artistic talents in the portfolio. That's very important. And a portfolio becomes your letter of recommendation. The other thing about letter of recommendation, do not underestimate the letter of recommendation from your own dean in your medical school, wherever it is. But that dean has to be more careful. Ideally, they should call the program director. And I'll give you an example. When I was active as a program director until last year, we used to get 7,000 applications. Don't be afraid. I'm going to tell you something which will upset you. 7,000 applications for 17 positions. Now you tell me, how can I be fair? Can be. If the system is unfair against you, so what do? I get thousands of letters of recommendations. And I will tell you, and don't tell anybody else, but I'll tell you that I never read a letter of recommendations from certain countries. I won't name the countries because they are bogus. It is written by a secretary, stamped and sent it out. It doesn't mean anything. So what you do in your medical school, you cultivate a relationship with your dean, assistant dean, educator, somebody at a higher place, and have them call the program director by phone or a personalized email on top of the letter. It is doable. A lot of my residents have done that. That immediately puts your application on the top. Immediately. Because out of 7,000 applications, I may get 5 calls. And those 5 will be on the top of my list. Because somebody took trouble of calling me with different time zones and everything else. If somebody calls, it has a lot of meaning. So make sure that somebody, it doesn't have to be the dean. It could be an assistant dean. It could be a faculty of somebody of importance, but have them call by phone. And many times it's very difficult to get the person you are calling by phone nowadays because everybody sort of has a voicemail. So what you do, you send an email. a personalized email. And the email should say, the dear doctor so and so, I have sent a letter of recommendation for this candidate, but I want to re-emphasize and give you more feedback on this candidate. And then maybe a couple of lines, not a big long letter. And that will go a long way towards an interview. Because the program director will then say, okay, here the dean called me, so let us interview this candidate. Happens all the time. So make sure that but you cannot do it at the last minute. You have to have time to cultivate a relationship. So once again, do not underestimate the value of your home country, wherever you are coming from. It doesn't matter. It doesn't matter what country you are coming from. It doesn't matter what school you are coming from. To some extent, it does matter, but by and large, you can overcome all that. The any questions on letter of recommendations? Because I'm going to move along. I'm going to spend the remaining time, half an hour, on interview, because that is where everybody struggles. The first hurdle you will face is whether you are getting an interview or not. How many of you are in the current cycle of residency? Okay, 1, 2, 3. Okay, almost I can't read everybody at the same time. Okay, but you are preparing for the interview. So can somebody tell me how are you preparing for the interview? What are the key elements of an interview? Number one. And number two, how long does it take for the person who interviews you, program director, let's say, to make a decision in your favor or against you? You already crossed the application process. Your application is accepted. Your USMLE scores are good. You are good at letters of recommendations. All that is done. Now comes the interview. So you are invited to go for an interview either by Zoom, like now, or real, personal. Personal interviews are becoming less and less popular nowadays. I don't know why. Because I think that's what we should be doing. But let's say you're doing on a Zoom. What are the things you need to prepare? Somebody will tell me, don't be shy. Then this is the time to make a mistake. So if you say something absurd, it's okay. Ishana, you want to tell me?
Dr. Kothari, maybe the first would be the lighting and the setting and where
Very
you're
good.
in the background,
So
and
what are the elements of setting? What things you must make sure that they work,
it would be the clean background, something that's not distracting.
right?
And a lot of people I've heard also try to put something that they're into, like someone who's interested in traveling puts a world map, or someone who paints. I've heard people say it's good to put a painting.
I'm glad you're saying this, but try not to overdo that because that can be distracting by itself. So
That's
a
true.
plain background with a picture of somebody you admire, a medicine logo, something of that sort, but keep it simple and plain. But the first thing before that is to make sure that internet connection is absolutely 100%. I have seen in interviews failing because of the connection. So you will have to, I don't know technology, but get somebody, or maybe you know, but make sure the internet connection is valid. Number one. Number two, always, always, always be on time. You don't want to open the room and you're not there. That happens all the time for a variety of reasons. Time change, internet connections, etc. Um, what about you yourself? What should you be careful about? What kind of clothing?
Formal clothing, professional attire, hopefully for men the blazer and a tie, and formal shirt, and for women mostly a plain blouse, which is not distracting, and a coat, formal coat.
Yeah, the dressing should never overwhelm the person. So, yes, what you said is entirely correct, but very proper. the thing which always amazes me is the hairstyle. People come with all kinds of hairstyles. So be careful. These are important things, and they will notice that. When we used to interview in person, um, I'm talking about going back many years, my first impression I made by looking at the shoes. Of course, on Zoom you can't see the shoes, but the shoes. Because the shoes will tell you what the person is. And my father used to say that if you want to marry somebody, go and look at the kitchen. So it is funny, but it is true. So be very careful. The other thing about interview is that let's say you're interviewing with me and it is live interview. You come to my place, make sure that everyone you encounter, you treat them cordially, respectfully, and properly because they are all asked to watch you. Fellow residents will watch you, they will report what you did. The secretary, most important person in the interviewing process is the secretary. Don't piss her off because she will go and tell the program director that this person is not acceptable. I've seen this many, many times. So, be natural. You all are good people, polite people. So show that. But just because she is a secretary or just because you encounter a PGY one resident doesn't mean anything. Be very respectful and show it. Um, we talked about your dress code. Be yourself. Don't be somebody else. There is no need to. I cannot tell you more, but you are very talented group. So be yourself and show it to them. Um, and listen. Don't many times students like you would prepare a script. Please do not do that. You may want to practice, but do not prepare a script because you are not giving a lecture. What you are essentially doing is listening to what they are asking. And your answer should be very appropriate for that question. If you are scripted, you may want to go to the script and vomit up the answer. Don't do that. Listen, take time. There is no hurry. Listen. And I wanted to tell you, I think I told you last time, in the first 3 minutes of the interview, the decision is made. 3 minutes. You have 3 minutes to show who you are. So be careful, very careful, and don't be shy in asking questions. So, how do you ask questions? Let's say you are interviewing in my program. What should you do? How would you prepare for asking me the questions? Anyone else?
So I would know the program inside out. I would know everything about the program and then ask questions which are very specific to the program and my goals.
So you need to research the program, number one, and that takes time. And there are many ways of doing it. You can go on ERAS and look at the program, but that is not really good. You need to touch someone who has been in through the program. If a student who you know, a faculty you may know, their reputation, their board pass rate is published by the American Board of Internal Medicine, their accreditation, do research, make notes. Also research the program director, how long he or she has been there. If you see 3 program directors in 4 years, it's a red flag. In my days, when I was your age, a program director's job was forever. You die as a program director. Today, an average resident in medicine goes through 3 program directors in 3 years. That's a fact. There's nothing you and I can do about it. But research the program director. The other thing is the key faculty. You will know who the key clinical faculty are. Research them, particularly if they have done any research in publications. So, for example, you interview with me. If you research me, you will know that I am interested in bedside medicine. You will know that because it is written all over. And then when you interview in front of me, you should ask me questions on bedside medicine. That tells me that you are really interested and you can dig into the facts. If let's say I'm from New Brunswick, New Jersey, so you should investigate whether New Brunswick has any particular fame. Do you know New Brunswick has any fame? Nobel Prize for Medicine in 1952 went to a Dr. Waxman at Rutgers, across the street from St. Peter's, for discovery of streptomycin. That's a huge fact. Is it important for residency? No. Is it necessary to know? No. But that tells me your interest. If a city has the largest church, for example, you may not even be Christian. You can say that I love St. Patrick's Church in New York. So go outside the box and try to figure out what you should be telling. But research is very important for interviewing process. And then you can formulate your questions. Um, the always maintain an eye contact when you talk to anybody. Maybe you know this. This is nothing new. Eye contact, because if you don't maintain an eye contact, they will determine that you are really not interested. And I told you last time, show enthusiasm. Everybody knows now what enthusiasm means. The word origin of enthusiasm. Come on. Where did the word come from?
Sir,
Nobody?
Greek.
Theos.
Theos,
Theos,
God.
meaning God.
Greek.
When God is in you, En is in, Theos means God. Theology, if you study theology, you're studying religions. So when God is in you, you are enthusiastic. So what is God? Your God may be different than my God, but essentially God is energy. Energy. Why do people worship the sun? Many cultures, Egyptians, Hindus, they worship the sun. Why do they worship the sun and not the moon? The reason is sun has unlimited energy. Why do they worship snakes? Think about that. Because the snake can kill you with the energy. So no program director wants to see a candidate who is meek and doesn't have much energy. So how do you show it? You show it by your behavior, by your facial expressions, by talking. And we talked about speech last time a little bit, and I'm going to dwell on it more and more as we go along. Most of you come from the subcontinent of Asia, India, Pakistan, Bangladesh, Nepal, etc. And therefore, you have a belief that you know English. I'm telling you, you don't. You know English, a written English, but you don't know spoken English. Language is for communication. If you talk to me and I don't understand what you're saying, then you don't know the language. So please remove that misconception that you speak very good English. You may. I'm not denying that. But you need to practice more and more a good spoken English. I gave you a bunch of clues how to do it. Listen to television shows, turn off the volume, and watch the expression on the face, how they do it. Listen to yourself, tape record. I guarantee you, if you haven't done this, I guarantee you that if you tape record yourself and listen, you will have a nervous breakdown. It is very awkward to listen to your own voice, but you need to practice. So get a cheap tape recorder, cost $20 and record yourself. The other thing which I cannot overemphasize is Spanish. This is a Spanish speaking country. It's a number 2 language today, but for you, it will be number 1 language. Because most Spanish speaking people come to our clinics because they are poor. They don't have insurance. So, for example, at our clinic at St. Peter's in New Brunswick, 80% of the patients speak only Spanish. They're not bilingual, they speak only Spanish. And you, as a resident, will be taking care of them. So, fluency in language is absolutely essential, just like reading an EKG or an electrolyte. And there are many ways of doing it. You can do it on your phone, the Duolingo and all those programs. You can do that. You can have a Spanish speaking friend and you can converse with them. The way I look at it, you need to invest time, energy. And I gave you a website called Maximo Nivel. Maximo Nivel is a language school in Peru, Guatemala, and Costa Rica. All 3 countries run this school. Very highly reputable, relatively inexpensive. I think I sent you a brochure. Please look at it. And they will pick you up at the airport and bring you down when you leave. And you live with a Spanish speaking family, eat their food, and speak Spanish. At the same time, they will also ask you to go to the health centers and see what kind of medicine they give to the population. So it's a total cultural recovery from what you don't know. Now, let me give you the inside secret. I have 25 applicants, all have the same USMLE scores, all come from reasonable schools, and all are coming from the same country or similar country. And I have 25 of them laying. How do I know who to interview? They all look same. If you give me evidence that you speak fluent Spanish and you were in Peru for 1 month doing the cultural exchange, you will be on the top of my list. I can tell you that. We were specifically looking for Spanish speaking students who we can recruit. Because if I don't have a Spanish speaking resident, I have to provide an interpreter. An interpreter costs $25 an hour. I have 51 residents. They spend 30 hours, little less than 30 hours a week. And you do the math. It's extremely costly to have an interpreter. So what we do, we give them these websites where they can translate. It's not good. But if you were fluent in Spanish, you have solved a major problem for me and this patient. So do not underestimate the value. We don't have to go to Maximo Nivel. You can do there are many programs in the world where people go. But I think this is the one I have tested and it's very good and I would highly recommend that you communicate with them. The visa is easy. If you are on a visitor's visa from Southeast Asia, India, Pakistan, etc., the local government will give you the same tourist visa up to 6 months. And the cost is bearable. You spend more money now doing these rotations than you will be spending. You will learn the language, you learn the culture, you will see a beautiful country. So there are lots of advantages. I don't have any vested interest in that. I don't get a penny out of it. But I think it is an important thing for you to know now and do it before you interview. After the interview, and during the interview, I told you, be very careful about your mannerism. Don't get anybody upset. Don't be late. Usual dress code, which we just talked about. And be humble. Humility is a virtue. You need to show that, but don't be meek. Humility many times is interpreted as being meek. No, you don't want to be meek. Because one of the criticisms against international graduates is that they are meek. They are not aggressive. Why would a doctor be aggressive in the first place? I have never understood that. Why should a doctor be aggressive? Yeah, if you're in ICU, maybe it's a different matter. But you doctor, be kind, be gentle, be humble, and show it. You have to show it. Any questions on interview process? They might ask you, tell me about you. What will you say? Anybody want to try? Let's interview somebody now. Ishana, I know only your name, so I will ask you. You are sitting in front of me, you've gone through the process, and I say, okay, Ishana, tell me about you.
Okay, good. Good afternoon, Dr. Kothari. Thank you for the opportunity for the interview. I'm Ishana Kaur, as you know. I'm an IMG from India. I finished my medical school in the southern part of the country. I did 6 years I spent over there, which formed a very good, solid clinical base. And being brought up in a family of like army officers, I was the first generation doctor in my family, so it was a very new experience. Then I did feel by the end of my medical college that I wanted to be a well-rounded physician, so I came to the United States, pursue the path of USMLE, and I'm here sitting in front of you with the best opportunity you could possibly provide. I'm not very well prepared, Dr. Chai, sorry.
That's good. That you clearly have thought about it. Because otherwise you would not have said what you said. It was a good beginning and good end. And then let them question you more and more. They may question you about your 6-year program. Be prepared. They may question about you. The one word which I loved you to say is clinical medicine. Always bring up clinical medicine. Don't forget that you are applying for internal medicine residency. So please do not go into fellowship unless asked. That is a major error. If I was your program director and you came for interview, and it happened actually, young lady came, very bright, good scholarship, and first question she asked me, I said, before we start, do you have a question? How do I get cardiology fellowship? That was the answer. And that candidate was out immediately. I said, do you realize that you are interviewing for internal medicine program and not cardiology program? It would be like in high school, somebody says about college. No, you finish high school first. So practice this, be prepared to answer questions, tell a story. That is the way to do it. And do it slowly as Isana did and carefully. Every word is important. I don't want to forget the clinical part of this whole thing. You need, since I assume most of you are coming from Southeast Asia, did I miss something here? Probably not. But clinical medicine is dying everywhere. In America, it is dead. I don't even say dying. So if you can invest some time in clinical medicine, bedside, examining patient, taking a history, developing a differential diagnosis, formulating plans, the old traditional way of doing things, you will be ahead of everybody. So how do you do that? Let's suppose you are in Mumbai now and waiting for all these things to happen. How do you show to me, program director, that you are preparing for clinical medicine, bedside medicine? What do you do? Anyone has any idea?
Maybe
Dr.
working
Patel,
as a medical officer.
that doesn't train you for clinical medicine. You're right. Yeah, practice makes you better, sure. But once again, depends where you practice. If you practice with your uncle in one village, that is not practice, because that is a common mistake I see. I did a rotation with my uncle. He has a nursing home. No. You don't want to go there. You want to go to an academic place. It doesn't matter what academic place, but you need to go to an academic, attached to a medical school or a residency where they train people for MD, things like that. But the way to do it is, number one, to register and get a certificate of expertise like an MD in India or Pakistan has a similar program. And every country has a postgraduate residency. So you sign up for that. Many people don't. It bothers me that why you are not using a precious resource because your application will go up. Second, you may not have thought about it, but get an MRCP, member of the Royal College of Physicians. Do you know how to get it? Ever thought about it? It's very easy. You have to write 3 exams, part 1, part 2, and PACES, clinical. Part 1 and part 2, you can do it from wherever you are. There are centers all around the world. St. Peter's, where I come from, is offering part 1 and part 2. PACES is offered in 30 countries, but it's difficult to get in because there is a long queue. But to prepare for PACES is easy. Google PACES videos, and they will give you dozens and dozens of videos. Make a list what you have done and somehow insert this in your CV. So, for example, there is a video on ankle jerk. There's a video on knee jerk. There's a video on communication. Watch them. They take 6 minutes, each one of them, about 6 minutes. And collect them, maybe 100 of them. But that, because there is no other program anywhere where you can go and sign up for bedside medicine. It's a shame. But you can do it on your own. And you can tell there is a website called Stanford 25. Write it down if you don't remember. Stanford 25. It is from University of California. Do you know Abraham Verghese? Abraham Verghese is of Indian origin, professor of medicine at Stanford, and he created this Stanford 25. He calls it a low-hanging fruit. So you can pluck it and eat it. And they give you clinical skills. I would recommend that you watch all of them and somehow put it in your CV, in your application, that you have witnessed Stanford 25 100%. That will take you a long way. And they will ask you, what did you like about that? It's a wonderful series. We are going to do it on my website, something like that, very soon in the future. If you can get it with diploma, for example, if you are going into pediatrics, just an example, you can get a diploma in pediatric medicine. It is not MD, it is DCM or something. So you can do that. The other areas of expertise you should develop is in my plan B. Plan B is in case you do not get a residency, that is not the end of the world. You can do a lot of other things. You can do a course in statistics and get a certificate. No one knows statistics. After 50 years of work, I do not know statistics. I would not have said this 20 years ago, but now I can say that. So but don't do anything where you do not get a certificate. You have to get a certificate. And that means little bit of expense, commitment, etc. But I would do that. By the way, if you go to Peru or Guatemala, you will get a certificate of expertise in Spanish culture and Spanish language. They will give it to you if you finish the course. So I would do statistics. I would do epidemiology. There's another certificate you can get because after COVID, we understand how important epidemiology is. So you can do that. You can do an MPH, Masters in Public Health. One of my residents did it in 9 months at Harvard. That should tell you something. But it requires time, commitment, money, all that it requires. We should do it anyway. You are spending money now, you are spending time, resources, so why not do it in a proper way? You can do MHA, Masters in Hospital Administration. Same thing, it is a 2-year commitment. I gave you a website called IHI, Institute for Healthcare Improvement, IHI. IHI is an independent agency which provides you knowledge in patient safety and quality. They're separate. And there are modules. Each module takes about 2 hours to run at home. You run the module and you take a small exam. And I think 12 modules are necessary to get a certificate, and then you can get board certification in quality and safety. Just imagine when you go for interview and you say that I have a certificate for quality or safety or both, how much chance will increase? You need to pay attention to this thing. That is in my plan B. And there are many more. We will talk about different plans. Any questions so far? In my website, there is a profile of one of my residents. His name is Dukas, Sartorius Dukas. He is Greek in his birthplace, went to Slovakia in medical school. So he is an international medical graduate like you and I, and did 4 years of research at Yale University. 4 years. Now you guys are all ready to go into residency on July 1st, which is fine, but don't be in a hurry. You cannot achieve high level of competence without investing time. So be prepared not to go into residency in July, but you should have an option. And the option should be very vigorous research. This one month research being scut work on somebody, Mayo Clinic and all that, it's completely bogus. No one is going to select you because of that. No one. Research cannot be done in 1 month. You have to have minimum 1 year of research committed to that project. And it's available if you are willing to participate. So this Dr. Dukas did 4 years of research at Yale University, and he got his PhD while he was a resident. And now he is a GI fellow in New York City. He did GI fellowship at our place, and then he did an extra year, and next year he will join St. Peter's faculty. So I'm giving you this because it can be achieved, and you are no exception. You all can achieve this. I want to throw a positive feelings about you and your future because it is available, and it would be not good if you waste it because of misconceptions. People tell you this, people tell you that. No. You need to have a very clear path of what you are going to do. It's 1 o'clock. Any questions so far? There is a website of American Diabetes Association. Look at it. They give you certificates of diabetes education. At this age, at this time of your life, I would collect as many certificates as possible. So if the ADA, American Diabetes Association, is giving you a course in patient diabetes education leading to a certificate, if it doesn't lead to a certificate, it is not okay. It has to lead to a certificate. So you need a piece of paper saying that you have done this. Same thing with IHI, Institute for Healthcare Improvement, Quality and Safety. You need a certificate. Without certificate, nobody is going to look at it. So start collecting these things, be industrious. There is a limit to the number of observerships you can do. I have known candidates who have done 8, 9, 10 observerships, all in Brooklyn for some reason, I don't know why. Don't do that. Not necessary. 1 or 2 good ones is all you need. Good ones, academic type. And there you develop a networking with people. If you do an MPH, you will have all American faculty. So the stigma of being an international graduate is gone right away. After 60 years, I am still facing the stigma of being an international graduate. It doesn't hurt me. I'm fine with that. But it's not going to go away. It's just like your skin color. It's not going to go away. So make use of it. Consider doing a PhD. I'm throwing very vigorous effort on your part. So if Dr. Dukas in my program did a PhD, why can't you? You can do it. But you have to make an attempt, and people will tell you, why are you doing this? Go for residency in July. Yeah, it's okay if you do that. But why did we all go to medical school? What was the reason? To take care of patients, to serve the community, and be a scientist. The green card, the blue card, whatever cards they give nowadays is not important. We will talk about visa in the future webinars because everybody gets hung up on visa. Don't do that. There are 12 million people in this country who do not have a visa. So nobody is going to throw you out. As long as you do some constructive work, it's very important. And I told you last time, and that is the very important thing, there is an internationally trained graduates. Now there's a new column. So if, for example, anybody doing MD in Southeast Asia, India, Pakistan, here in this group? No? You know what I'm talking about? The postgraduate education, let's say in India, I keep saying India because that's the most I know. That doesn't mean Pakistan doesn't have it. They all have similar curricula. But if you do a 3 years of MD in India, you immediately become a candidate for license in this country in 21 states. Now, it will be 30 states in a couple of years. That's not a bad deal. You have to be under supervision like anything else, but you can do that. So if you are thinking about doing an MD back home, please continue to think about it. If you can do residency here and pass your board exam, why can't you do MD there and pass your MD exam? It's simple. But you need to go think beyond the box. Don't get hung up on cardiology or pulmonary or oncology. It's premature. Okay, questions? Anybody has any questions? It's 1 o'clock, 1:05 actually.
Dr. Kothari, I have a question.
Go ahead. Tell me who you are.
Dhruval Patel.
Okay.
My name is Dhruval Patel.
Dhruval.
So the question is, like, will these 21 states what you just talked about,
Yeah.
will they require the visa to apply?
Yeah. Anyone coming to US will require a visa. And right now, as you know, the political climate is not for visas. But it will change. America will never stop people coming in.
So basically, I just wanted to ask about myself for the backup plan. Right now, I am doing MPH in NeuroShell, so I am in a student visa F1. So I did my med school from the Ukraine. So it was saying that degree with MD, but it is equivalent to the MBBS in India.
Yeah, they know more than you and I know. That's okay.
Yeah.
So you have a medical degree, you must be CFMG certified, you must finish step 1, 2, and 3, and then you have to find a sponsor who will take you as an employee and monitor you. There are some rules. Every state has a different rules.
Right.
And they monitor you for 1 year, 2 years, and ultimately they give you the full license.
All right. So for this process, so I have to apply for the visa again, right?
Of course. Yeah, visa is always the primary situation. You have to have a visa. You cannot enter US without a visa.
Right. But so right now I am in US in F1 visa. So do I have to contact with those doctors who
Yes.
is ready to
Yeah,
take
every state has a different set of rules. It
Right.
is not yet completely determined, but keep an eye on it. They keep on printing new versions, every state board, and the reason for doing this is scarcity of doctors in the United States. There are areas in this country, believe it or not, for 100 miles there is no doctor, even now.
Right.
So if you are willing to go through serving in an underserved community,
Mhm.
it's ideal. Now, can you become a cardiologist? Probably no. So, because now you are obliged to work under those terms. But why get hung up on a discipline at this stage of your life? Why do we become a cardiologist or a rheumatologist or a pulmonary doctor? It's just a tool. It's a tool. It is not what you do. You will take care of patients. That's all that matters. So keep your mind open. That's what I'm telling you. Don't get locked in. Oh my God, I can't become a cardiologist. There is no particular virtue in becoming a cardiologist. Be a good doctor, serve the community, enjoy the practice. That's all we need to do. Money is there, irrespective of what you do. You will make decent income. Yeah, some people may do more than the others, but it all depends. I mean, if you really want to make money, you don't become a doctor. You go to Wall Street. Right?
That's right.
So
Makes sense.
keep your dreams in check, and don't get swayed by your seniors. Oh, you do this, you do that. No. Make your own judgment. Any other question anybody has?
Thank you, Doctor.
We are going to third webinar next week, and I'll drill down more on each issue. So you will have ample opportunity to ask me questions. You can send me an email. I think last time I got one email, and I talked to the candidate. Any question, it doesn't matter. I'm here. My motivation for this is to help you, because once upon a time I was you. I am and was an international medical graduate, and I know what you all go through. In my days, it was relatively easy. Today, it is hard. Imagine 7,000 applicants for 17 positions. It's absurd. It should never be like that. And this country needs doctors. They project 136,000 less doctors in next 10 years. How are they going to fill the gap? That's why they're opening up the states with a temporary license. And that license, if you follow the rules, will become permanent after a couple of years. Every state is different. So keep an eye on it. They publish their data now and then. Okay. Anybody else? Thank you for coming. Please spread the word, because a lot of people register but they don't show up, which is okay. If I can help one person, I will be happy.
Dr. Kothari,
yeah.
one question before we left.
Sure.
So I have other colleagues who were observers at the hospital as well with me, but they were not able to register on time, sadly. But for right now, they wanted to register, and they did reach out to me and ask that they're not able to register. So they're interested in attending, but I think that maybe there's a cap on registration. So is there a way?
Right now it is open. It's open. We haven't reached the cap. It was supposedly for 100 registrants, but we have not reached. I think we reached the number 70 today. But they're welcome to register anytime.
Okay, I'll check with the
I want to
candidate.
reach out to as many people as I can.
Okay.
That something like this is available, because think about this. I should not be doing this. This should be done by the American Medical Association, the American College of Physicians, and I have been on both councils. And I brought this up at the national level. I brought it up at the state level. Everybody says yes. Nobody does anything. For example, I don't know whether we have time or not, but I'll tell you. The observerships you all do, is there a organization which promotes this? Is there a spokesperson for you? Does anybody speak for you? If you are outside the window, you are now looking in the building through the window. There is no place for you. This is the reason for my motivation of doing this. Who is speaking for you? And it did occur to me for 40 years that I should be doing this, but now I do because I am retired. And I know a lot of IMGs personally, professionally. And it's a wonderful program which we did at St. Peter's for 10 years. And now that I'm retired, I thought I should expand it on the Zoom and do it across the board. And this is just the beginning. We are going to do a clinical program. I'm going to actually do a board review course for that, including clinical skills. Because there is not a single place in the world where you can register for clinical skills course. None. I tried to do it with St. George's a few years ago. Didn't work. Because then they removed the CS exam. Once the CS exam was gone, nobody was interested in clinical skills. But tell your friends that the site is open. They can register or they can send me an email. My email is known to all of you. I'll be happy to facilitate. But more I see, better the program would be. And if you have any special needs, just reach out to me.
Thank you so much, Dr. Kothari.
You're welcome. Anyone else?
Hi, Dr. Kothari.
Yeah.
You answered my email last week. Thank you for solving my query. My
Okay,
name is Abhinav Sharma.
you are the person who is doing nephrology, right?
Right, that's right.
Okay.
So I wanted to ask, like, when we are given the opportunity to ask program directors about do you have any questions from the program? So is it advisable to ask personal questions, like a certain program director has done his residency, then became a faculty, then APD and PD from the same medical program? So is it advisable, like, I ask him that what are the qualities that made you stay in this program for so many years?
You can get a generic question that what made you stay so long in the same institute. But remember, you have very limited time. Very limited
Okay.
time, and everybody's in a hurry, sort of. So use that time very wisely. What did you find in this program which made you stay from residency till program director? I think that is a fair question. And
Okay.
they should be able to tell you that, the answer. Yes, absolutely. But if you do
Okay.
research like you are doing, please make sure that it is substantial for a long period of time. It's like cooking a good meal. It is not fast food research, but it should be substantial. 2 years, 3 years, 4 years. At your age, doesn't matter. 4 years doesn't matter. You can invest 4 years. But imagine yourself 5 years from Ryan, now, Dr. So-and-so, ND, PhD. Do you think that will make sense? If you are a PhD? Yes. It is a powerful way to enter anywhere you want to go. You can be a professor in 10 years. But don't do 1 month of abstract. The other thing which I forgot to tell you is this mining thing. You know what I'm talking about? Mining data. You buy a program from the government or somebody. They give you 150,000 atrial fibrillation cases, and then you mine the data and you prepare a document. Don't do it. It's bogus. You are not qualified to do that kind of research. You have to be a cardiologist to appreciate 160,000 cases. I know lots of students do that. No. Join a research group, Mayo Clinic, Yale University, substantial university. Commit yourself to 2 3 years, work hard, and hopefully you will produce some substantial results. That's the way to do it. Anything else anybody has?
Thank you so much for answering my question.
You're welcome.